Let's take you back to the topic around stroke risk factors such as high blood pressure and type 2 diabetes becoming more common in younger and middle-aged people. According to a report released by the South African Medical Association journal, stroke is the second leading cause of death after HIV/AIDS. Over 120 out of 100,000 people aged 35 years and younger die from strokes annually. However, stroke is preventable. Primary healthcare physician Dr. Angelique Coetzee joins us now to expand on this. Dr. Coetzee, very good evening to you. Thank you so much for your time. I mean, the numbers coming out from the South African Medical Association journal listing a stroke as the second leading cause of death after HIV/AIDS. I mean, that's quite frightening. Why is it becoming more prevalent in younger and middle-aged people?
Good evening to all your listeners and viewers out there. Yes, that is actually very true. This is what we are seeing. And as you correctly said, stroke is a preventable disease. It's part of our non-communicable diseases. And the reason why this is getting more and more prevalent amongst the younger people is that stroke is caused by hypertension and diabetes. That's the two most common comorbidities or risk factors. So people with hypertension and diabetes are more at risk of developing stroke. Then if we look at diabetes, currently diabetes is one of our 10, it actually falls under the second important or that killers in South Africa. You know, when we looked at the COVID war 2020, the top killer, then it was diabetes and vascular disease, that is then hypertension. So we know that younger people are getting much more diabetes and more prone to diabetes. It's a lot to do with lifestyle. As well as, unfortunately, you know, sometimes you can't use your legs. It might run in a family. It is also important to understand that there are modifiable risk factors that you can change. As I've said, it's high blood pressure. See that there's a higher incidence.
Dr. Coetzee, it's interesting that you speak about hypertension, and I'm hoping that the line will hold for a little longer because the quality is not sounding so great. But hypertension has been dubbed a silent killer. That in itself is a risk factor. How does it then now warn you that you could be heading for a stroke?
So you need to remember it falls under cerebrovascular, so it's a vascular disease that you are looking at. So your high blood pressure and your diabetes, high cholesterol, smoking, all of that contributes to this. And it's also important to understand what is a stroke.
Yeah.
Because patients doesn't always understand that a stroke is when the blood flow to an area of the brain is cut off. And then those brain cells are deprived of oxygen and then they die. You get two different types of stroke. So one is ischemic stroke and the other one is a hemorrhagic stroke. And depending on your disease or which one you have, you need to get treatment. And we always talk about the golden hour. So, you know, I need to remind our listeners out there that brain, you know, every second that you lose on your brain, that part of the brain is dying. So you need to be within 1 hour to try to get a CAT scan. Within 4 hours, you need to start getting treatment. You need to decide which one of what type of stroke it is. You cannot just give someone an aspirin because if it's a bleeding stroke where you bleed, you can worsen that. If it's a clot, the aspirin will help. Most of the clots, or most of the strokes are clots, but we need to look at that. And also remember the other thing that you have also asked is HIVs also, you know, you are at higher risk if you've got HIV to get a stroke.
So what can be done to avoid it? I mean, you say it's preventable because over 120 out of 100,000 people aged 35 years and younger are dying from strokes annually. That in itself is a huge concern.
It is. It is a totally preventable disease. So we have got a problem in South Africa. So we are not focusing on preventative medicine. We're focusing on what we call hospital medicine. The moment when there's a problem, we want to cure the problem. It's too late. If you can start with doing your cholesterol levels, your blood pressure levels, and your sugar levels around about the age of 40, if you don't have a history in the family of any of these diseases, you might save yourself a lot of trouble going forward. However, if you are younger and there's a family history of a stroke, diabetes, hypertension, cholesterol, or any other heart diseases, you need to start screening the patients on an earlier age to prevent this, because it's treatment. And then you need to take your treatment. If you take it on a daily basis, your blood pressure tablets or your diabetes tablets or your cholesterol tablets, you can prevent this.
And as you talk about the preventative measures, I mean, the quality of life that one should be living, what should it embody? You speak about whether or not, perhaps it's inherited or hereditary and it's in the genes. What can one do knowing that information to ensure that they themselves don't get hypertension or diabetes or perhaps even suffer from a stroke?
So besides going to get your blood tests done and a general examination on a yearly basis, start looking at your lifestyle. The stuff that you can modify, that you can change. And there you can change your diet, you can change your stress levels. You can help with a bit of regular exercises. Nowadays, exercise only means around about 150 minutes a week that you need to walk. You don't need to go to a gym. You just need to walk or be a bit more physical active on a daily basis than you are. Check your weight. Stop smoking. Remember, excessive alcohol consumption and drug abuse also increase your risks. And then, again, look at your conditions like atrial fibrillation, any other coronary artery diseases that might put you at a higher risk.
Yeah.
So it is important to look at that. There's nothing you can do on your age, your gender, and your family. But you can go for your tests.
Very well. Thank you so much for speaking to us this evening. Primary healthcare physician, Dr. Angelique Coetzee, talking to us there a little bit about the stroke risk factors and some of the preventative measures that one can embody in their lives.